If you are having seizures that are not well controlled and you've tried at least 2 anti-seizure medications and are still having seizures, then you could be a candidate for epilepsy surgery. You don't have to have focal epilepsy for it. Focal epilepsy is usually a better candidate for it, but even if you're having generalized seizures, pre-surgical evaluations could be helpful for you. So what is a pre-surgical evaluation? It is to see if you are a candidate for epilepsy surgery. It is an evaluation that is pre-surgical, just as the name entails. Essentially what they'll do is they'll suggest you get some imaging. Usually it's an MRI or a Pet-Mri, sometimes both, to see where the seizures are coming from. There are other tests that could also be helpful, including a DTI scan. Tests such as a WADA scan are also done. DTIs and WADAs are more helpful if your language part of the brain is involved or your motor or sensory part of the brain is involved. If any of those concerns are there, then we'll proceed to a WADA or a DTI. However, in general, an MRI and a PET-MRI are the 2 required studies. And then we admit you to the Epilepsy Monitoring Unit or EMU to capture your seizures. Usually we'll need at least 3 seizures, and all 3 need to look alike. If they do not look alike, then your doctor will talk to you day by day, and you might need to stay even a little longer to capture all your different types of seizures. While you're admitted and we are capturing seizures, there'll be memory testing, which is neuropsychological testing, as well as a psychiatric evaluation, just to make sure that you are a good candidate for brain surgery. After all of that is said and done, there is a surgical conference with all the neurologists and epileptologists at the center. We present your data and we see if you're a candidate, and if you are a candidate, what kind of surgery you would be a candidate for. That information is then presented to the patient by their neurosurgeon or by their epileptologist, and further decisions are made based on this. If the patient agrees to proceed or the doctor thinks it's a good idea for the patient to proceed, then they can discuss among themselves doing a pre-surgical evaluation part 2. That'll be in the next video.